Hey everyone, first I would like to welcome you all to ClariPi's AI Theater presentation. My name is David Lai. I'm the Global Technical Sales Director at ClariPi. I believe most of us sitting here have experienced the power of AI in one way or another. Whenever we use Face ID, trying to log into my phone, the AI recognizes my face while disregarding all the background objects as noise. It identifies and verifies my facial features to match the login credentials. Artificial intelligence is a growing feature that is in our everyday lives. Likewise, ClariPi's product uses artificial intelligence to remove unwanted noise in medical imaging and turns data into useful information. So today I will introduce two of our leading products in AI medical imaging, which are related to ultra-low-dose CT scans and also lung diseases. Okay, so ClariPi was founded in February of 2015 to provide innovative solutions for the unmet needs in the medical imaging. It is through a convergence of intelligence, big data computing, and medical imaging technologies. Our products were born through long-term collaborative research between engineering and medical experts. It is our mission to benefit people's health and well-being through the use of AI technology. Now I will introduce to you ClariCT AI. It is an AI-powered CT denoising solution for ultra-low-dose CT scans. To give everyone here some background, CTs have become one of the primary tools for medical imaging diagnosis and truly have benefited the healthcare community immensely. However, there's one big downside to CT imaging. It is a lack of radiation safety for patients. Currently, CT radiation dosage is considered a serious health issue worldwide. Radiation is identified as the first-class carcinogen. Various international organizations and political entities such as the UN, WHO, IAEA, and the EU have all recommended to reduce the X-ray dosage in CT scans. So therefore, there's a dilemma constantly facing us today in the imaging field. Do we choose to lower the radiation with increased risk of reduced accuracy, or do we choose the higher radiation dosage while increasing harmful effects on patients? The trade-off between radiation safety and high-quality imaging have been a tough balancing act for radiologists for a long time. So ClariCT AI was created to solve this dilemma. Now you can lower the radiation dose while still retaining the high-quality CT image for accurate diagnosis. No more trade-offs and no more sacrifices. ClariCT AI is the CT image denoising solution that satisfies both sides of the need. So this flowchart demonstrates how ClariCT AI works. It has been extensively trained with over 1 million images from various age, race, size, and weight of patients. ClariPi has patented its unique training technique with different conditions of CT parameters. Over 2,100 combinations of different current, voltage, kernels, and CT models make ClariCT AI the most powerful denoising solution to date. Noise-corrupted low-dose or even ultra-low-dose images can be processed and turned into clean and denoised image for accurate diagnosis and interpretation. The solution can be deployed either through an on-premise workstation or cloud-based solution. The workflow is simple and fast. So the AI receives DICOM images from the CT scanner and performs the denoising process. Then it sends these high-quality images to PACS for viewing, interpretation, and storage. All these processes are automatic and provide seamless integration into your everyday workflow. So now let's take a look at the powerful denoising performance of ClariCT AI. Here is one ultra-low-dose CT image taken on ACR Phantom. These are comparison pictures between filter band projection, iterative reconstruction, and ClariCT AI's algorithm. We can see that the vendor's IR technique does drop the noise level from 35 to 19 HU, but ClariCT AI does it even better with lower dose level of 12 pounds per unit. Furthermore, the texture is more natural compared to the blocky texture presented by the IR technique. Here on the left is the ultra-low dose CT image, which was taken with 10% of low-dose radiation. The noise makes the accurate diagnosis nearly impossible at 0.2 millisievert. The middle image is the noise component predicted by our ClariPi engine. It shows only the pure noise components without any anatomical structures. To the right, we have a noise cleaned image from ClariPi AI. It is produced by subtracting the noise component from the original noise corrupted image. The end result is that ClariPi AI produced a high quality denoise image comparable to that of a regular or even high dose CT. So this image is taken with 120 kilovolt and 5 mass. You can see the strong streak noise resulting in poor image quality. After ClariPi AI performs the denoising process, the image allows for the observation of pulmonary structures. This is a big improvement with an amazing 87% noise reduction. Here is our last comparison example. Even a case with extremely noisy image is not a problem. The almost unrecognizable pelvis image can become a clean image with great quality and details of bones and soft tissue structures. So ClariPi AI revolutionizes CT imaging to be safe for patients, particularly for pregnant women, pediatric, and cancer patients, all without sacrificing imaging quality. It also reduces operating costs and is vendor neutral, compatible with any DICOM CT implants. So now the next product I would like to present to you today is called ClariPi. It is a fully automated 3D AI reporting solution for lung diseases. So there has been an increased upward trend in the number of lung diseases and lung disease-related death caused by asthma, COPD, pneumonia, and etc. So over the span of about 30 years, there was a 40% increase in lung diseases worldwide. However, the supply of a doctor is a much slower rate than the demand for the doctors, causing many physicians to have more workload and thus resulting suffering from burns out. The current worldwide pandemic also complicated the situation even further. So an AI solution is needed that help to address these needs. So organizations like RSNA, WHO, even a Fleischner Society all have published guidelines regarding the proper use of CT for COVID-19 patients, showing that it is one of the arsenal for our fight against the pandemic. These studies indicate that quantitative analysis function can play a critical role in the management of COVID-19 patients. So in response to these needs, ClariPi is an early diagnosis solution that can accurately detect lung diseases such as emphysema, pulmonary nodules, and COVID-19, and is a highly useful product that provides a high dose level diagnosis report using ultra-low dose imaging. The software is a dedicated quantitative CT solution for lung screening. It provides both low and high attenuation area analysis, and the LAA was tuned for emphysema, and HAA was tuned for COVID-19 and pneumonia. So here's a flowchart showing us the work of mechanism of ClariPi. The first step is the process is for the Clarity engine to denoise noisy CT image to produce clarity enhanced images. So, and then the second step is to use our analysis engine for segmentation and identification of lung structures, such as the right and left lung airways and diseased lung tissues. And then the last step is to provide the user with a clear and concise 3D color-coded report for an analysis result. So now let's see some example cases. On the left is a noise-corrupted image, which results in incorrect diagnosis. However, with denoising, we get to see the real condition of the patient. Our powerful denoising engine ensures the accurate analysis and report even with low dose or ultra low dose CT scans. Here is the CT image of a typical COVID-19 patient. We can observe a mixture of ground glass opacity and consolidation patterns in the lung area. It is predominantly more in the right lung. ClariPi segments and correctly classifies GGO and consolidation region automatically in real time. The report shows the percentage of infection in lung volume and patient disease severity level. So in another case of COVID-19, the patient in this case is in a critically ill condition with 54.6% of the lung infected. The majority of the lung is occupied with GGO consolidation. Here are some example cases of ClariPi test dataset consisting of a wide spectrum of COVID-19 cases. ClariPi has passed all the tests and has shown a robust performance. Here we have examples of LAA and HAA analysis report. The 3D color report intuitively shows lesion distribution in the lung. The pie chart presents the relative ratio of lesion volumes among segmental lung zones. In addition, the color overlay shown on the representative axial slices help a visual confirmation of proper analysis by the AI engine. In this slide, we have the performance test result. For LAA analysis, we used the world's largest lung cohort study data set. The graph on the right compares the agreement of emphysema index between standard dose and low dose CTs. The agreement is poor for the data point without denoising. However, after denoising, the agreement is almost perfect compared with the result of expert radiologists. So COVID-19 analysis function was tested with a MOSMED data set from Russia, consisting of more than 1,000 patients in 5 different severity categories. As shown by the bar chart on the right, ClariPi correctly analyzed and classified the patient with 97.3% accuracy, which is the world's top performance as far as we know. ClariPi is an award-winning solution. It has won first place in the low-dose emphysema challenge in the Korean AI Medical Image Challenge. So now comes to my last slide. Today you have just seen a glimpse of our AI products. We created these software solutions to satisfy the unmet need in medical imaging. We believe our solution has brought in an innovative approach to existing dilemma, resulting in a simply clinical workflow and improved patient care. Our company's value is to improve people's quality of life. Many material items, when lost, can be purchased again. However, each one of us only has one irreplaceable body. There's no better way to improve our quality of life than by taking care of our health. So at ClariPi, we continually strive to innovate. We have more products in development in our next 5-year product pipeline. We cannot wait to share with you all. We wish our AI technology can bring you a healthier life. So ClariPi's booth is just a few steps away, right over there at booth 4760. We will be happy to show you a full demo and speak with you more in detail. Thank you very much for listening and coming today.